Hi guys, welcome back. 2 lives in a row. I'm being very fancy today. But no, I thought while I'm being driven, I shall chat to you guys about allergies. So, I've gotten quite a few questions, comments on the various TikToks that I've done and the YouTubes, etc., asking about being allergic to anesthesia or certain aspects of anesthesia. So what I thought over the next couple of minutes in Dr. Tristan Explains to the Public, I will speak to you guys about allergies, and hopefully this will help to give you some better insight and understanding on what allergies are, etc. So just remember, guys, disclaimer, this is meant as advice, excuse me, not meant as advice. It is information and general knowledge for the public. This is separate from my practice as an anaesthetist, and this is separate from the educational advice that I give to the medical professionals in Dr. Tristan Anesthesia tutorials. So please go and do your own research into the things that I'm telling you, and please always listen to your own doctors and follow your local guidelines, etc. So what is an allergy? Well, as we obviously kind of gather, an allergy is where your body recognizes something as being foreign, and your body mounts a response to that. So we just need to take 1 or 2 steps back just to give you a little bit of a better idea of what exactly the body's role is and what the immune system is trying to do. So it sounds a little bit strange, I think, but if I explain it to you, I hope you guys will understand it a bit better. Essentially, your body's immune system has got 2 jobs, and those jobs are similar but different. And they're probably, a better description would be that they're mirror images of each other. So what does that mean? It means that your immune system, your white blood cells, your natural killer cells, your macrophages, all of those extra things, your antibodies, etc., they need to identify a foreign virus, a foreign bacteria, a fungus, a foreign piece of material like a splinter or something that may be in your body. And they need to know this does not belong to Tristan, okay? This is foreign, I must attack it and destroy it. But at the same time, your body, as we sit here, has got billions and trillions of cells, of proteins, of antigens, of little pieces of bacteria. Remember, our gut is full of good bacteria, etc. So there are so many things in our body that are necessary for good health, for our sort of day-to-day functioning, etc. And the immune system needs to be able to look at these things and realize that these belong here, let's not attack them. Okay, so for example, if in your lungs, okay, as I'm sitting breathing here, I might breathe in some dust, okay, I might breathe in some bacteria. If my driver has been coughing a lot and refuses to take antibiotics, I get exposed to his bacteria, and my immune system's job is to is to remove those bacteria from my lungs. But at the same time, the immune system must not attack my own cells in my lungs, because then I'm going to get inflammation and it might make the problem worse. And that's often what happens to people with severe infection. So not to get into the politics of COVID, but if we just talk a little bit about the impact of it on the body, we know that it was a virus that would affect the lungs, but the bigger damage came from the body's own immune system realizing, oh, there is a big problem. We've got a foreign virus here, and it launches an all-out immune response, okay? And that response can often damage your lungs. So those are the 2 things. Just to recap, your immune system needs to be able to recognize in your body, and it also needs to recognize what is normal cells in your body, okay? So what is an allergy then? An allergy is an immune response, a reaction, okay, most of the time to a foreign substance, okay? So things like bee sting allergies, things like peanut allergies, dust, grass, I'm sure we've all got a host of allergies. When it's summertime and springtime, I struggle in particular with a bit of hay fever, a bit of allergy to pollen, and all of those things. So those are sort of normal allergies, not a major issue. But there are obviously, as there are degrees of severity in everything in the world and in medicine, there are allergies that can be severe and life-threatening. So let's talk about allergies to sort of substances in the natural world. We'll focus on two, the allergy to bee stings and the allergy to peanuts. So a bee sting allergy, the first time it happens to someone, you will probably get a bit of a redness, swelling, a local immune response, local inflammation. However, if you are unlucky enough to develop an allergy to bee stings, you most likely will end up suffering a condition called anaphylaxis. And that is an overwhelming, catastrophic, life-threatening allergy where the body releases so much histamine and so many other compounds that your throat closes up, your lungs close up, your blood pressure drops down, and if you don't get what they call in America an EpiPen, or what we know as adrenaline in South Africa, you will potentially die. And that is a dire emergency. And it's the same with peanuts. People who develop a peanut allergy or a shellfish allergy, that it ends up being absolutely catastrophic and life-threatening. However, people who are allergic maybe to a fabric softener or who have a little bit of lactose intolerance, their allergy will manifest as a much more mild reaction. So when it comes to allergies to medication or things in theatre, in anesthesia or in medicine in general, the three things that you are most likely to be allergic to are, number one, antibiotics. We all know penicillin allergy, all right? The second thing is muscle relaxants that I use in theatre to relax your muscles when we are operating on you. And that medication is called rocuronium. And that's got a very high incidence of allergy or anaphylaxis. And then the third one, interestingly enough, is latex allergies. That happens more commonly amongst medical professionals because we are touching the latex so often. And that's often a local skin allergy, but it can become a systemic allergy. And some patients may have latex allergies as well. So when we talk about an allergy to penicillin, if you tell me that you're allergic to penicillin, I will avoid it pretty much at all costs. However, just remember, guys, that if you had some diarrhea, some nausea, or you got a little bit of a rash, that is not a true allergy. That is just a reaction or exaggerated side effects, okay? A true allergy to penicillin is anaphylaxis, as I exposed. So full body rash, what was called hives, itching, throat closing, shortness of breath, etc. You must be aware of that, and you must disclose that, please, okay? If you are allergic to any other medications or drugs, please tell the anesthetist, but it doesn't help me to say, oh, I'm allergic to morphine. And I'm going to give you a practical tip here. You can't really be truly allergic to morphine because your body produces its own opioids, okay, that work on the exact same receptors that have got very similar functions. So if you took morphine and you had incredible nausea and vomiting, that's not an allergy, guys, okay? But I'm not going to sort of question you. I'm just going to interrogate you a little bit to say, okay, is it truly an allergic reaction, or did you just have severe side effects? So what happens in theatre if any of these things happen, all right? So the most common reaction is to, as I said, the muscle relaxant, rocuronium. And that's not something that you get every day unless you are having surgery. So often we don't know. So I'm always prepared for anaphylaxis. And as part of my consent, giving informed consent to all patients, I tell them that there is a tiny risk of being allergic to certain medications, but I can manage it. So once you give the medication, whatever it might be, that the patient has an allergic or anaphylactic reaction to, the first thing that happens is their heart rate shoots up and their oxygen saturation drops, and they have difficulty breathing, or I have difficulty ventilating them with my ventilator in theatre. Their blood pressure will drop, and they will start to get a skin rash in the next few minutes to hours. However, you must react to it quickly. I recognize it by those specific factors, as I've told you, plus years of experience, plus knowing, okay, what drugs did I just give in the last 5 minutes? I gave rocuronium, or I gave an antibiotic. Okay, those have got a high risk of allergy. The treatment is with fluids and with adrenaline. And I'm just going to say this, guys, for the lay public, for doctors listening, medical professionals, nurses, paramedics, anyone. The treatment for an anaphylaxis, the treatment for a severe allergic reaction is adrenaline, 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 epinephrine, and EpiPen. There is no ifs, ands, or buts, guys. This is life-saving, and I have seen so many casualties make life-threatening mistakes because they don't give adrenaline, okay? Giving an antihistamine, give it. Go for it. Happy days. Giving some cortisone, go for it. Happy days. But the thing that will save their life and the thing that will stop their airway closing is adrenaline. Adrenaline, adrenaline, or an EpiPen, okay? So that is anaphylaxis. That is a severe allergic reaction. And in anesthesia, as I said, it most commonly occurs due to muscle relaxant drugs or antibiotics, but it can be due to exposure to anything in theater. And in particular, don't forget about latex. So there was then a question from, unfortunately, dying from anesthesia. Now, you might have been told in having an anesthetic consent or something like that, that you can be allergic to the anesthetic gas. It's a colloquial way of speaking, and I've probably used it, but I don't like it and I discourage it. There is a specific genetic condition called malignant hypothermia, whereby you can have a catastrophic reaction to anesthetic gases as well as the muscle relaxant succinylcholine. It is incredibly rare. In my more than 10 years of anesthetic experience at the busiest public hospital in the country and the continent, I saw one true malignant hypothermia. So it is very, very rare. 1 in 250,000, 1 in a million. It's hard to say. It can be managed. However, there are generally some telltale warning signs. And those would be people who have unexpected death under anesthesia, especially when they were not very sick to begin with. People who have complications from their anesthesia, have an ICU admission after routine surgery, and a family history of this happening across multiple generations and multiple relatives. There is an excellent testing center in South Africa for malignant hypothermia, and it is a talk that I will specifically give to anesthetists and medical professionals. But just so that you know as the public, that is the condition when we say that there might be a very, very, very rare risk of having a severe reaction to the anesthetic gases. It is malignant hypothermia. It is most commonly inherited through an abnormal gene down the family tree, but there can be a spontaneous, out of the blue, person in your family who has malignant hypothermia. We are well trained to manage it. It is so rare, but so critically important to understand that every anesthetist from day 1 to day 5,000 of their, or 50,000 of their career, knows how to manage it, but hardly any of us will ever see it, so don't stress about it. So I really hope that you guys enjoyed this. I hope that Dr. Tristan explaining allergies and explaining a little bit about malignant hypothermia was helpful. You will all see me a little bit later. Neonatal anesthesia week, guys. So everybody, for the lay public, I'm going to be talking about what is prematurity, what are the common issues with a baby being premature, and what do I do as an anesthetist to try and help to prevent these complications. And for medical professionals, we're going to go everything, guys, from in utero physiology to the transition to birth, from fetal life to outside the uterus. We're going to talk about NEC, we're going to talk about CDH, TOFs, neonatal physiology, PSOPs, everything and more. So I'm so excited, guys. Thank you so much. Have a wonderful day. Be safe. This is Dr. Tristan. Remember, this is not medical advice. It is just intended for general knowledge. Please go to patreon.com/Dr. Tristan Anesthesia Tutorials.